Hello everyone, and welcome to this week's edition of NHIS in a Week. Here, we give you happenings and insights of the authority and the scheme. My name is Bridget Apia. Now the headlines. NHIS cracks down on illegal payments. Nigerian health insurance CEOs understudy NHIS. NHIS staff donates 800,000 Ghana cedis to Mahama Cares. Now to our first story. The National Health Insurance Authority is intensifying its fight against the co-payments and illegal charges. This crackdown comes as the authority prepares to implement a massive 120% tariff increase designed to remove any excuse for healthcare facilities to overcharge members.
During a high-level visit to the WHO Ghana country office, NHIS CEO Dr. Victor Asari-Bampo was blunt. Illegal charges are a threat to the scheme's integrity. He stressed that the upcoming 120% tariff increase must be accompanied by improved compliance from providers. Supporting this stance, Dr. Fiona Bracker of the WHO emphasized that aligning the NHIS with Africa's Universal Health Coverage UHC goals is non-negotiable. Meanwhile, Acting Director for Claims, Dr. Abigail Dechi Kwating, reminded the public that free primary healthcare remains the backbone of the system, ensuring that even as the NHIS supports high-cost treatments, basic access remains free for all.
Moving on, Ghana's NHIS remains a blueprint for the continent. A delegation of health insurance CEOs from Nigeria concluded a 4-day training session at the NHIS headquarters to study the Ghanaian model.
The Nigerian delegation praised Ghana's structured progress. CEO Dr. Bampo shared his 3-point vision for the future: tightening internal controls, eliminating fraud, and prioritizing staff welfare. The visitors were particularly interested in the Mahama Cares initiative and how it integrates support for people living with chronic illness into national productivity. Financial stability was also a key role.
Moving on from Nigeria, in a remarkable show of corporate citizenship, NHIS staff have voluntarily raised 800,000 Ghana cedis in support of Ghana Medical Trust Fund, popularly known as Mahama Cares.
The donation is intended to bolster the fund's mission to treat chronic illnesses. Presenting the check in Accra, Dr. Victor Asari-Bampo noted that the contribution was entirely staff-led.
Today, we're very pleased to be here, and we're here for one purpose. We believe in the vision of His Excellency President Mahama. We know that it's something that we really must support. We are proud of the way that you are working here at the Ghana Medical Trust Fund. So staff of the NHIS decided on their own volition to actually come together and make contributions so that we can also bring our widow's mites to support the noble efforts of the President and yourself.
Reflecting a deep personal commitment to the patients they serve, Ms. Obobia Dakon Opoku, administrator of Mahama Cares, expressed profound gratitude, stating that the fund's success is inextricably linked to the NHI's technical and financial support. The event saw full attendance by the executive management team, signaling a unified front in the fight against high-cost medical condition.
To the next story. The Membership and Regional Operations MRO Directorate have headed to the Volta region to crunch the numbers. The 2025 performance review focused on one goal: achieving universal health coverage by the end of 2026.
Under the theme, Achieving and Sustaining UHC in 2026, a Collective Responsibility, Acting Director Mr. Sebastian Alakpulinsa singled out districts like Afram Plains for their over and above performance despite resource constraints. Looking ahead, Acting Deputy CEO of Operations, Dr. Senanu Kwesi Jokoto, called for a digital-first mindset to match these announced plans to revamp and institutionalize the customer service desks placed at selected healthcare facilities and unify public messaging to ensure every member feels the impact of these digital upgrades.
Moving on to Gambia, the Gambia is the latest nation to seek mentorship from Ghana. 2 senior officials from the Gambian Health Insurance Authority have concluded a 2-week study tour to strengthen their NHIS system.
Finance Manager Ms. Issa Tugayi and PR Manager Ms. Fatim Kar spend time delving into NHIS electronic claims processing and call center management. By visiting regional and district offices, they witness firsthand how digital innovation simplifies member registration. Deputy CEO of Administration, Mr. Raphael Segbeb, welcomed the bilateral exchange, noting that Ghana is proud to lead the way. The Gambian officials departed with a roadmap to implement similar digital efficiencies in their home country.
Now to our final story. The NHI is heading to campuses. The new NHIS Campus Connect initiative has officially launched at the Takoradi Technical University, bringing NHIS registrations and renewals directly to the student body.
The launch coincided with TTU's Akwaba Week celebration. The Acting Deputy Director for Marketing, Ms. Joyce Angela Asidu Esquire, urged students to take charge of their health security by using on-campus registration booth.
There are many myths surrounding NHIS. That is why initiatives like Campus Connect exist, to replace the myths with facts and help young people make informed decisions about their health. This is your opportunity to engage, ask questions, visit the booths, renew or register your NHIS, and share your experiences.
The Vice-Chancellor, Reverend Professor John Frank Ishon, lauded the initiative, noting that a healthy student is a productive student.
Medical health care is very important. So coming in to help us be able to get people registered in order so that we can be able to reach out to them. Sometimes students may be in critical situation, but they don't have money, they don't have health also. So the university has to come in, pay for all these things before they will get access to good health care.
Adding to the excitement, Western Regional PR Manager Mr. Raymond Aria reiterated that the 120% tariff increase would ensure that the hospital students visit a well-funded and free of illegal charges. Campus Connect is set to roll out to all major tertiary institutions nationwide.
Jimmy Ruffle, I don't understand. I hope you've been taking your medication. I do better. Hey, foul. And I say, be pedroni boarding.
Hello, ma'am.
Hello.
Good afternoon.
Good afternoon.
My name is Adam. From National Health Insurance Scheme, I'm here with my colleague and I would like to talk to you about the new NHIS app.
Oh, so you people are here to test my faith, eh? Listen, let me tell you. There's no power above or beneath that can compete with the supernatural. There's no better health insurance than being kept by the power. And I'm kept by the power. And my whole family is covered. Oh, let's see what they have to say.
No need to worry, Ghana. At the Power of Ye, with over 500 medicines to take care of you, the new NHIS app has you covered. All you need is a valid Ghana card to register for yourself and for others. My NHIS app gives you access to credentialed health facilities and services across the country. Access to healthcare just got easier.
Download the My NHIS app to register yourself, your family, and your loved ones. Yes, you can register and renew NHIS membership for others too. All you need is a valid Ghana card. The new NHIS app gives you access to credentialed health facilities and services across the country with an extensive benefits package. Access to healthcare just got easier.
Jimmy Ghana card in a register maybe says, yeah.
National Health Insurance Scheme, your access to healthcare. Download on Google Play Store or Apple App Store. Terms and conditions apply.
This brings us to the end of this week's edition of NHIS in a Week. For more stories, do log on onto our website on www.nhis.gov.gh and visit our social media handles displayed on the screen. Thank you so much for watching. My name is Bridget Appiah.